So in my earlier videos on my channel, I talked about how to stretch a very young baby with no head control, and then what to do with that baby when she gets too old and too active and strong to allow you to stretch her. Today I'm going to talk about babies in that in-between stage, when babies are strong enough to hold their heads upright but not old enough to crawl just yet. I wanted to talk about right-sided torticollis in this video so that I don't confuse anyone. So if your baby has left-sided torticollis, meaning the left side of her neck is tight, then you'd want to just do the opposite side for all these exercises. Okay, so for all these exercises, your baby should be old enough to have head control. These are active exercises to help strengthen the weaker side. So one of the most simple things you can do is tilt your baby to the right. Okay. By simply tilting your baby to her right side and sitting, you're elongating the tight side and crunching up the weaker side. So this, if you just hold her like this all day long in a sitting position, she is doing the stretching herself for that tight side. Another play position for babies this age is to place her into right side sitting. Okay, so when you prop her arm down like this, what this does is it depresses this shoulder and makes it once again easier for her to elongate her right side and crunch up her left side. She can play in this position, she can look up over her right shoulder, and this is the position for her to work on her crossing midline. That important skill of playing across midline. So this is a great position for her. Another great position for babies this age is when you're trying to teach them to transition from sitting to quadruped. So that hands and knees position. So the best way to do this is, once again, you're going to have her roll over her right hip when she's going from sitting to crawling. You want to teach her to go exclusively over her right side. So once again, just to show you the hand position for that, we're going to tip her over her right side and then help her over to her hands and knees like this. Once again, by having her go over her right side, you're bringing down that right shoulder, you're stretching out the right neck, and you're crunching up the left side, making that weak side work a little harder. Okay? Everything that I'm showing you, once again, is for that right side. It's for a baby with right torticollis. So it's when the right neck muscle is tight and the left neck muscle is weak. I get this question a lot. Parents ask, is it okay for me to be doing exercises all day long, concentrating on just one side? And that is absolutely okay if your doctor or physical therapist tells you that your baby has right torticollis, okay? Because that baby is going to be using her left side all day. As a reminder, it is super important to work with a pediatric physical therapist who can see and work with your baby in person to know what your baby needs. Thank you.